Understanding and managing chemo rage. A patient's guide chemotherapy, while essential in fighting cancer, can have profound effects beyond killing malignant cells. One often overlooked consequence is the dramatic shift in mood and behavior known as chemo rage. Intense, uncontrollable anger that arises during or after treatment. Up to 75% of patients experience cognitive difficulties. Chemo brain, alongside these emotional changes, creating a challenging and often frightening experience. The biological and psychological roots of chemo rage isn't simply frustration with illness. It's a complex interplay of physiological and psychological factors. Certain chemotherapy drugs directly impact the brain, particularly the frontal lobe responsible for impulse control and decision-making. For example, cisplatin can disrupt this region, leading to increased irritability and aggression. Specific drugs are more likely to trigger mood swings. Alkylating agents like ifosfamide and temozolomide can cause agitation, while platinum-based drugs, cisplatin, carboplatin, oxaliplatin, are linked to fatigue, anxiety, and cognitive impairment. Even steroids, commonly used alongside chemotherapy, can intensify emotional volatility. Beyond these direct effects, cancer treatment can disrupt hormone levels, reducing estrogen in women or testosterone in men, further destabilizing mood. Crucially, chemo brain itself makes it harder to cope with stress, leading to panic and rage. The patient is facing a life-altering illness, a loss of control, and often relentless physical discomfort. This context is vital. Chemo rage isn't just a side effect. It's a reaction to an overwhelming, unjust situation. Recognizing the signs and what it feels like, chemo rage manifests as sudden, explosive anger stemming from fear, frustration, and helplessness. It's not rational. It's a visceral, overwhelming response. Patients describe feeling furious over trivial matters, like a well-meaning gift from a loved one, because everything feels wrong and out of control. The shift is often jarring. A quiet moment can escalate into an uncontrollable outburst. This unpredictability adds to the distress, as patients may feel unlike themselves and worry about harming relationships. It's a feeling of being trapped in a body and mind that are betraying them. Strategies for coping with chemo rage. Managing chemo rage requires a multi-pronged approach. The first step is awareness, learning to identify your triggers, the daily stressors that now feel unbearable. Once you know what sets you off, you can prepare for those situations. Open communication with your healthcare team is crucial. Tell your oncologist or nurse how you're feeling. They can evaluate if medication adjustments are needed, antidepressants or anti-anxiety drugs can help, or refer you to mental health support. Seeking emotional support is non-negotiable. Counseling, support groups, or psycho-oncology specialists provide a safe space to process feelings. Remember, mental health is as important as physical health. Practical self-soothing techniques can help. Deep breathing. Try 4-7-8 breathing. Inhale for 4, hold for 7, exhale for 8, or box breathing. Visualize tracing a square while breathing. Relaxation. Listen to music, go for walks, or look at calming images. Self-compassion. Reflect on what triggered the anger without self-judgment. Finally, talk to your family and friends. Explain chemo rage and ask for understanding. Caregivers also need support, so encourage them to prioritize their own well-being. The bottom line: chemo rage is a real, distressing side effect of cancer treatment. It's caused by a combination of brain changes, hormonal imbalances, and the psychological burden of illness. By recognizing the signs, seeking help, and using coping strategies, patients can navigate this challenge and maintain their well-being throughout treatment. If anger feels unmanageable, don't hesitate to reach out to your healthcare provider for personalized support.